Hi, I'm Dr. Valerie Johnson. I'm the clinic director here at Natural Wellness and Chiropractic. I love chiropractic because when I had my car accident, chiropractic was really quite beneficial for my whiplash and my headaches, but I also had other benefits while receiving chiropractic. And I had already studied as a massage therapist, so I understood a lot about the muscles, but I was fascinated how all of these other symptoms were improved just from chiropractic, and it didn't have anything to do with the car accident. And when you study physical medicine, you are focused on what the issue is. So for instance, if you have shoulder problems, then they're going to focus on the shoulder. What's wrong with it? But doctors know that if you have right shoulder pain and you don't have any musculoskeletal problem, the next place to look is the gallbladder, because the gallbladder can refer pain up to the right shoulder. But that's where it stops, and it shouldn't, because you can have shoulder pain and sometimes it's coming from the neck. The neck, if it's not functioning properly, moving properly, then you can have pain refer from the neck down into the shoulder. And it might not be anything wrong with the shoulder at all. The other thing that can happen is at the bottom. The elbow is supported by the shoulder. And if the elbow is not functioning properly, it's not moving the way it's supposed to, it makes the shoulder work harder, and that can make the shoulder hurt. But doing drugs or injections into the shoulder won't help that, because that's not where the problem is. So we don't want to mask the problem. We don't want to do drugs. We don't want to do injections. We want to find the underlying cause and improve the function. And many times when you do that, when the body functions better, the pain dissipates. So chiropractors do focus on the spine, but not because we're back doctors, but because the spine houses the information highway between the brain and the rest of the body. The body talks to the brain through the spinal nerves that go back up through the spinal cord. So let's pick one of these. The spinal cord runs all the way through the spine, and at each hole that you see here, there's a spinal nerve that comes off the spinal cord and goes out to a different part of the body. And if you look at this one here, this nerve goes out, around, and down to the stomach. Now, if this area is not moving the way it's supposed to, it's not functioning the way it's supposed to, it can make all the ligaments and the tendons and the muscles in the area really tight and swollen. If that swelling or the disc swelling pushes against that nerve that's coming out of that hole, it can disrupt the message that's going from the brain to the stomach. In fact, neurology has verified that it only takes 5 grams of pressure on the spinal nerve to disrupt that message. And if the brain can't talk to the stomach and the stomach can't send messages back to the brain, how can the stomach function properly? The brain controls everything in the whole body. So if you have a stomach problem, I will check here. I will check to see if there is a problem in that bone or the muscles around it that might be pushing on that nerve. But what if it's not? What if it's not that the bone needs to be adjusted? Well, then we keep looking. We keep looking for the underlying cause, because the only way the body will heal itself is if you get rid of the real underlying problem. So it may be lifestyle consultation. It might be changing your diet or taking supplements. Maybe you're having problems with digestive enzymes. So we have to find what is the underlying cause, and then we can help your problem. Thank you for watching, and if you want to call the office, you have a problem that we can help with, the number is down below the video. Thank you.